Thursday, the 27th of October 2020. Good morning and welcome. This is KBC News Check. My name is Bentroy Njue, and Ann Wangeshi will be our sign language interpreter for this program. Well, you will agree with me that in March of 2020, the whole world and Kenya as a country, we were grappling with the new unseen enemy, that is the coronavirus pandemic. And of course, it's changed the way we do things, the way we do business, and of course also actually, let's say, entered all our social circles. And at least we have been able, because of the vaccine and of course the austerity measures that have been taken by Kenya and other countries, we've been able at least to manage the situation. That is what we're going to be discussing today. What are the socio-economic impacts of the COVID-19? Exactly a week ago, the head of state did ease restriction and of course towards welcomed with open hands from all sectors. Of course, opening up the economy by declaring that the curfew that had run for almost 2 years was coming to an end. Of course, we are registering 1%, 2% of the positivity rates. That is a sign of good riddance. And of course, a lot came with the COVID-19 pandemic. How are we going now from where we were? How are we going to get back to our lives? How has it impacted on our socio-economic and of course on our mental capacities? That is a conversation that we are going to be having, and right now I'm joined in studio by Dr. Leonard Njeru Njiru, who is a psychiatrist at the Kenyatta National Hospital. He's also a psychiatrist at the Madari National Hospital, and of course he will be telling us more on what he does. And on my extreme left, we have Newton Ogada. Newton Ogada is not the first time that he's been here, and I do remember we hosted him when the pandemic had really hit us. Newton Ogada is actually a philanthropist, and he has been helping people and the vulnerable since before the COVID-19 pandemic hit. How has the situation been? How are we supposed to pick up the broken pieces and join them so that we may be able to actualize our normal life? That is a discussion we are going to be having. Remember, you can be part of this conversation via all our social media platform. At KBC Channel 1 is our Twitter handle. And of course, for comments, suggestions, or even where you are watching us from. Of course, we will be from time to time heading to some of the functions that are currently happening to just check on what is happening in the country. A lot mostly is bended on matters politics, but each and everything, including socio-economic ones, we will be able to visit them and see what exactly is happening. So, gentlemen, karibuni sana.
Thank you. Thank you very much.
Yes, and perhaps to start with you, Daktari, how has the COVID pandemic hit hard, and especially when it comes to people with mental illnesses? Because at the end of the day, the COVID pandemic has come up with a new challenge. A lot of people have been mentally affected, but there were people who are having other conditions, including mental illnesses. How hard has the pandemic hit?
So thank you very much, my good friend Misheni, first for having me here today, join you in studio to discuss this poignant and very important issue that has afflicted our society, and in fact has affected each and every person in one way or another. You bear me witness that our world today and our world in the past has experienced very many different kinds of catastrophes, disasters, bad situations that actually have a big impact on how us do our things day to day.
Indeed.
In Kenya, in particular, we have had various situations: the bomb blasts, the terrorist attacks. Occasions and again, we have famines, disasters, road traffic accidents, and all that. And when these things happen, they have an impact on the psyche of the society. How? First, they affect how we think, our levels of happiness, our levels of productivity, how we do think and feel about the world around us. And that is exactly what the COVID-19 pandemic has done to us. because we woke up one morning and we are told that there is a virus that has happened in Wuhan, and this virus is spreading throughout the world, and we have to be on a high alert. And then gradually we hear news of how it's spreading in China, it's spreading in Europe, it's spreading in the Americas, and you bear me witness that the day that in Kenya we got the information that the first COVID-19 pandemic has happened, each of us was,
in March last year,
each one of us was caught by, pangs of fear and apprehension and uncertainty. What is going to come out of it? And you see, gradually with the lockdown and the restrictions that were put in place and the quarantine and everything, we were in a situation that even us, primarily as healthcare professionals, we did not know in particular what are we handling. It was a new circumstance that we have to wake up to and know how to respond to. So as a healthcare professional, we had to give answers to our society, to our families, to our friends and colleagues. And then as a society, the Kenyan people had to adjust to a new way of doing things. With the lockdown, the curfews, the working from home, all these things disrupt our day-to-day life.
Indeed.
And what effect does that have on us? We have to change, working from home, working online, old people don't go to places of work, minimizing contact, social distancing, wearing masks, and all these situations.
We were just observing them, not knowing that they were really affecting us psychologically.
Indeed, they did affect us psychologically, because we have to find ways of living through this situation that we did not know about beforehand. And because of all these effects on how we do things, on how we think, on how we feel, there is a high likelihood of now us getting feelings of anxiety, apprehension, stress, because we have to stay indoors with our kids, throughout the day. We were used to them going to school. We have to stay at home and, live with each other. Sometimes we would see each other in the morning, and then later on in the evening, now we have to spend all the time at home. And then also because of the impact on our livelihoods, sources of income were affected, businesses were closed down, where we get
and actually the economy, sorry to cut you, but actually the economy was not doing very well, and now we were having another bigger problem. So mentally there were some people who had been affected mentally, and now the COVID-19 pandemic, did it aggravate the situation?
That aggravated the situation. You'd say, well, it was a domino effect. One block fell, hit another block, and gradually we have this situation escalating from good to
bad.
To bad.
Okay. Of course, we're going to go to the specifics on how it affected and how we can try and get ourselves from this deep hole. Newton, the last time we were with you here, we were talking about how things are tight, and especially when it comes to matters philanthropy, because at the end of the day, even the people who actually assist you to assist other people were also grappling with the same problem that we were as a country. How are things now? At least the COVID situation has a little bit eased. How is the situation?
First, thank you for inviting me again.
You're welcome.
To this station. I want to thank the organization here for always thinking about me to come and we discuss what's the situation in the country. The situation is still bad, it's still worse, because in Kenya here, I think the president announced 3-4 days ago that now he opened the country.
Which today will be the first week.
The first week now.
Wednesday, yes.
So if you compare 1 week after 2 years, that actually is nothing, because everybody is trying to wake up or catch up with the life. And again, what I can say about this is that this is a lesson to the whole world, more so to the country Kenya, because we saw that we were not ready to fight with anything coming abruptly, because nobody knew that there will be something like COVID in the country, and the economy was really bad even before the COVID. So before the COVID, the economy was bad, but things were really working day by day. But now, being the COVID came in again, it makes it so worse. To what we are doing at the ground, like supporting people, taking care of the children, and even doing the medical outreaches, we have been receiving some quite money from America. But now, being this thing happened to the entire country, it is not easy. It is difficult.
Yeah.
It is difficult the other side. It is difficult this side. So what I can say about it is that we as a country, before we look into those who are supporting the country, because we don't have any private person in the country, we all belongs to this country. The government should think of, or all of us should think of, how we can have some emergency money set aside for such kind of a situation. If you go back to the village, because me, I always work in the village with people all the day, all the night, you will find we have some poor families who does not even know about the COVID. Even before COVID, they could not manage to feed themselves well. Even before COVID, they could not manage to take their children to school well. But now, being the COVID came in, actually this thing entered to their brain. Some, I'm telling you, it's only that we cannot know how many people died because of the, not because of COVID, but because of the mental issues. Yes. Because when you think about it, maybe in a family, there's only one person who is a breadwinner, and they lost the job because of COVID. And then background of everybody, there was nobody again to be looked into. So it is not easy as we speak. We are still struggling. We are still having issues even now as I speak. When I talk about health, there was a certain young girl who was actually defined and thrown into a forest called Kodera Forest. She was being found with security who were patrolling in the forest. After she has stayed there for 3 days, she was almost dying there, and she's now taken to Rachuonyo District Hospital, sub-county hospital, and even there's no enough medicine, there's no medical equipments. They only have the doctors and the nurses, but there was no materials. So just imagine such kind of a person. I only talk about one whom I know because I'm taking care of that girl as we speak. I'm sponsoring most of, maybe 90% to support her. What of the cases that we don't know? We have some people who just die because nobody is there to stand in to fill the gap, and there are very many. So we're still approaching difficult situation because of COVID. Yes, yeah,
indeed. And Dr. what Newton is saying is quite valid because of the situation in the country and when it comes to mental illness. Do we, as a country, should we give more preference and attention to mental illnesses and conditions now that we have a wake-up call of COVID-19? Because even the president himself did say that this is headed towards deeper waters. So we need even to set up a commission or a task force, for that matter, to investigate exactly what ails Kenyans when it comes to mental illnesses and attention.
Very good question, Mishani. And first, I thank our president because if you remember clearly, when having one of the national holiday celebrations in Narok, he actually, for the first time in the history of this country, as the president acknowledged that actually mental health situations are significant and an important function, or rather problem, that the society is facing. And out of that presidential declaration in Narok, the president actually directed that we needed to have a mental health task force be set up and go out into the country and find out, go on a fact-finding mission to know what is actually happening on the ground. What is the situation of our mental health services in our country? The task force accomplished its purpose and actually gave a candid and elaborate report about.
Perhaps you can touch on a few of the things that came up in the task force.
Exactly. One of the poignant points that came up is that our primary health care needs to be strengthened more than it is now to be able to handle mental health situation at the community level. Newton has commented that we have that person deep down there in the village who has problems accessing primary health care. What about accessing mental health care? So that is an issue that needs to be addressed. How? First, by investing in the provision of mental health care services deep down in the grassroots of our society. Two, we need to strengthen our referral system. you know, because, well, unfortunately, we don't have adequate human resource for health and specifically for mental health care. How? The number of psychiatrists that we have in the country is not adequate to meet the population of Kenyans.
And especially now.
Especially now. The ratios are not very appealing. The number of other auxiliary mental health care providers is equally not sufficient. So these are findings, among others, that the task force actually brought to the table and made very clear and candid recommendations about how the country, the Ministry of Health, and the different county governments can now put in concerted efforts to actually build capacity in the provision of mental health services. So that. And then, of course, the Ministry of Health has been on the front line. We thank the Minister, the Cabinet Secretary, and the entire team that has been actively involved in actually addressing this situation. We have seen Mutahi Kagwe actually coming out into the open and actually saying that here we have a situation that needs to be addressed. We have seen our Cabinet Secretary and the Cabinet Assistant Secretary actually talking candidly about these situations. So yes, our government has been on the front line helping, and the efforts need to be actually concerted and more emphasis put on it.
And Newton, perhaps to lean on what Dr. is talking about here, you are in the community, you are on the grassroots, and looking at the situation, how was the situation be? Because at the end of the day, the protecting the vulnerable, you have a healthcare institution that helps not only the vulnerable, it also helps other people. How was it? How have you seen the situation when it comes to mental illnesses, and especially now that we've had COVID-19?
The truth of the matter is that we are failing to reach out the mental cases or our mental people in the community. Most of them are being hidden in the houses because nobody is there or ready to take care of them. Being I'm working in the community, I'm working in the households, we have a number of mental cases who nobody knows they exist in this country. And I appeal the way he's saying really things that are touching the people down there. Like, for example, the case I'm talking about. When I met the girl, she's kind of maybe somehow mentally affected because of what happened. A 12-year-old girl, when she's being raped or defined, you know, that situation. And we have those who are being born with the mental cases. And I don't know how the Ministry of Health has been reaching out the people, because let us speak the truth. We have some households who don't have the TV or the radio. They cannot reach. They cannot understand what the minister or what the Ministry of Health has been telling people in the TV or in the radio stations. My take to this is that we need, as a Ministry of Health, because I'm in the health institution too. I'm running an hospital. I've been doing a lot of medical camps, outreaches, reaching the people in the ground. What I'm pushing, what I'm requesting the Ministry of Health to take is just to make sure that we have enough people in the ground who can actually reach to the people, to the household, because, you know, in the community we have the community members, we have the leaders, the community leaders, we have the chief, we have the village elders. If you can have a health people who can actually be delegated to know and give us the number, because even if I ask the Ministry of Health today how many mental cases we have in Kenya, the answer will not be correct, because we have those who are there inside, nobody knows about them. So what I'm trying to say is that if you can work with the government, I think the county government is failing on health. If we can work with the national government in this, then we are going to succeed. Most of the hospitals, as we speak today, they don't have medicine. They don't have materials that can enable them to treat our patients rightly. Doctors talk about the transport system to the health facilities. It is really poor. We have some health facilities that there's not even road going there. You can only use motorbike or bicycle. When there's emergency, sometimes it's difficult for the vehicles to reach and do the transfer to the other referral hospital. So in health, you know, in the life of human, we have only three things. We have church, or mosque, for those who are going to mosque. Then we have health, then we have education. what we need to think about is only the three things. The school, we have mental cases at the school, and sometimes we cannot manage to take all our children to mental schools or special schools.
Yeah.
You know, because they are even few. We don't even have them. They have few. The Ministry of Education brought an idea of having one class for the mental issues, the special class. But it's only from preschool. We don't have it from preschool to class 8 or to secondary level. But the ones that we have are few. They are not enough. So they are being congested with the similar cases. So what we need to do as a government or as a country, we need to focus on three major things or four major things. We need to focus on water when we want to deal with health. We need to focus on health, which covers everything, and then with education. And then the country will be in a level where we can manage it. When the pandemic came, the Minister of Education announced very clear that now the classrooms that we have is not enough for our children.
Yes.
My question, how many do we build after the announcement? Maybe none. We announced that we need to have masks because of the health situation. We must go get anything related to health. Do we have enough as a country? We did not have enough as a country. So whenever we come to the TV like now, it is the best platform to speak what is in our mind and what is affecting the people in the grassroots. What is affecting the people there is that we speak a lot as the government, but we do less as the government. That is my take about it. Because what if now, let's just say, I'm not hoping it to happen, if we have another pandemic again apart from COVID, where are we going to go? Where are we leading? Where?
Actually, a good point that we were caught flat-footed by the COVID-19 pandemic. But actually, just as Newton has said earlier, the vulnerable are worst affected when it comes to pandemic and even other factors. A good example is what he's talking about. It's quite hard to know what the vulnerable are going through mentally. How can we reach these people so that we ensure that we have been able to identify the needs that they have, and especially mental, and how do we get them out of that? Now that at least COVID has a little bit eased up and things are starting to look up.
Good point, and I'm happy that my co-panelist Newton has brought up a very important perspective to this discussion. That this is a systemic situation, and it needs a systemic way of thinking to address the circumstances that we are facing. How? A pandemic like COVID affects virtually every facet of the society. Education, health, manufacturing, entrepreneurship, businesses, they have all been affected. And so to find the solutions, every piece of the society, every spoke in the cog and the wheel needs to actually be well fixed so that the wheel of our society can roar. About the questions that you asked, the vulnerable in the society, and in particular, those that are suffering mental health illnesses. How do we identify them? First, I'll bring up a quote that was made by one of the first presidents of the United States. It should be J.F. Kennedy, if I'm not wrong. He said, "Ask not what your country can do for you, but ask, what can I do for my country?" So I feel that each and every Kenyan needs to have this wake-up call with regard to mental health illnesses and the vulnerable in our society. How? Specifically about mental health illnesses, one of the things that deeply and heavily impacts those who are suffering is shame and stigma. Shame by the individual that they are going through a situation, and then stigmatization by the rest of the entire society.
Yes.
You know, because someone is going through this situation. And what comes out of it, you will go to some families because they have a child or a person who is suffering mental illness. They will feel ashamed and they want to hide. We have had situations that are brought up that they have chained children with these disabilities with chains in the house, in the bedroom, and they are staying there, you know, and they are hidden from the view of the rest of the society. We need to find a way to have this conversation. It's not normalizing an unfortunate situation, but actually opening up and accepting as a society that this is a problem and not being ashamed of it, but instead of being ashamed, seeking help. So when the person in the grassroots is able to open up and come out that we have a sick person who is suffering a condition, who is vulnerable, then the likes of Newton, myself, you, and the people of goodwill in the society will be able to come out and help. Because you bear me witness, we have people of goodwill who are ready and willing to help. But then if the problems are not brought to the fore, well, it will be compounding an already bad situation. Then to escalate it upwards now, we need systems by the government. Our government needs to put more investment in health, more investments in mental health care. We need more budgetary allocation. We need more investment in healthcare facilities. It's true what Newton has said and what the data says, because, well, we need data to know what is the situation on the ground. The data says that we don't have adequate healthcare workforce. We don't have adequate supplies in the healthcare facilities. So when people go to the hospital, sometimes it's quite unfortunate that they have to go and purchase their medical supplies from elsewhere. These are situations that should not be happening in our society as at now, when the world is talking about, sustainable development goals. Economically, what are we doing to ensure that the per capita allocation from the budget to each and every Kenyan is adequate to meet the basic minimum healthcare needs? So the government needs to think through this, especially around the budgeting process, the allocation of resources, the development projects that go on, so that our hospitals are done well. And then in the grassroots there, because that is where people are, Newton brought it up, we have community health workers. We have community health volunteers. These are formal mechanisms that have been put in place by the Ministry of Health to enhance and to foster community health care. Now, these people who are actually immediately in the society, they are interacting on a day-to-day basis. They know each and every household. They know how are people feeding in the communities, how are people's health status in the community. These people need to be strengthened. Give them an enabling environment so that they are able to actually go to the grassroots, go to the households, identify, this child needs help, this old person here needs help, because we might think so much about the children, but on the other end of the spectrum, we have the old and the elderly and the disabled. Yeah, well. So even those need to be taken care of. And because, well, we will not have the Minister of Health coming from going to the grassroots, we need to identify those people with the help of the local administration, the chiefs, the sub-chiefs, the village elders. So when now these concerted efforts scales upwards, we will be able to generate data that is representative of the situation on the ground. We are able to implement remedial measures, implement systems about how now to direct help to those people.
Indeed, and you can add on that, Newton, the vulnerable. You've been dealing with the vulnerable for years now. What safety nets should we invest in to ensure that the vulnerable are protected and empowered, just as like Doc is saying?
Yeah, I've been thinking about it because now we are in election year. I see all our big politicians running around campaigning for their votes. They are telling people to register for the votes. They are now telling even the mentor people to be taken to the registration so that they can vote for them. But I've never heard any of them talking about what they are going to do with the mentor people in this country. I've never heard them talking about what they're going to do for the widows in the community. I've never heard any agenda talking about how we're going to reach out the people who cannot manage. Let me tell you, we have 80% of those who are mentally sick and vulnerable dying because of a simple disease as malaria.
That's right.
We have 90%, if I'm not wrong, because they cannot access to any health facility. Number one, because they don't have the money. Number two, if they go to the public hospital, there's no medication. They have been sent home to go and buy some medicine from somewhere else. Number 4, they have not been reached in a way that the government can offer them the NHIF. It's only 500 shillings per family, to enable them to reach and to go to any other better hospital where they can get treated. But the agenda in Kenya is politics. The agenda in Kenya is talking about four big agenda. The agenda in Kenya is how we can beautify our country. But nobody is out there to talk about these vulnerable people, how we can reach them. Previous days I heard Raila saying he will give 6,000. That is not enough. What is enough is how can we reach them to make sure that they have health care services and cover, so that whenever they are sick, they can actually walk to get treatment in any hospital where they can manage to reach. Number 2, we have been neglecting the poor or the vulnerable in the community in this country. We only talk about the business community, the business people. We don't talk about things that actually they are good if you talk about them. But we are living, by the time we are getting the leadership in this country, we don't only lead for those who are able or those who have a class, but we are leading each and every person. My first question to the conversation was, do we have the data telling us how many, for example, me, I'm coming from Homa Bay, how many vulnerable people we have in Homa Bay County? There is no that data anywhere in the world. Even if you've been asked, maybe the number that will be given is quarter of what is happening in the community. If, the way the doctor said, if we asked today, how many mental cases do we have in Kenya? Apart from those who, their parents or their guardians have actually tried to reach to various or their hospitals to tell what is happening. We have a number who are just in the bedrooms. Nobody knows their cases. And thereafter, the Ministry of Security are there to walk into their homes and even arrest their parents or their guardians if they are doing something which is against the law. But we have never think health-wise, what can we approach these cases? Because there are people, they have their portion in the government of the Republic of Kenya. Yes. There's a portion. They have their birth certificates. They have their birth identification. When we talk about the number in this country, even if it is 40 or 50 million, they are being counted in the number. When we are looking for funding outside the country, or when we are taking loans, we are taking loans or we are looking funding, cover even them. But when the money comes to the country, when the project comes to the country, they don't get it. This is why I was saying, if you go even back to your home village, how many schools are built for the special cases? You might find in the whole county there are 10. But how the population is more than 10 schools. You see? So there is a portion of health that we forget in the country. We only talk about Mama Mboga, Mtu wa Jua Kali. We only talk about those who are going to give 6 million or 6,000, whatever. But we are not talking about the country called Kenya as a whole. We neglect a section. But this is not the problem for our big men. This is the problem under the Ministry of Health, because they have the power to push. I like the minister who was pushing about the COVID, Mutahi Kagwe. He was really working on that ministry. Yes. If he can take that pressure again, to know people individually in their homes through his arms, because the government has arms. Yes. We have district hospital, we have sub-county hospital, we have like even, how do we call them? These small dispensaries. Those are the arms of the Ministry of Health. We can reach these people if you have been given that chance. Or if there's somebody who's sleeping in their job, those who are down there. But if we reach them now, I'm talking to this new government which is coming after 2022. If they can actually sit down and have a talk on the health issues, yes, on the mental cases, on the poor people in the community, on the widows who are there suffering, on the single mothers. We have many single mothers who are not even married and they have children. They have 4 or 5 children. If we can have a conversation talking about them, then now the whole country is involved in all the problem we have in this country. But for now, we have a loan to pay. Right?
Yes.
We have a tax to pay, right?
Yes.
What is covering those people? There's no 1%. I've never heard anybody talking about 1% covering those people. I've never seen. I've never seen even the hospital. We have only mental hospitals, are very few. Me, I only know Madare and few of them.
Of course, Doc is going to
talk about exactly,
that. What goes on there. But still on the same, Doc, perhaps you can chip in with this one. We're talking about the vulnerable. We're forgetting that our kids are also vulnerable, because it's quite hard for a kid to know that he has been affected by the pandemic. It's quite hard to diagnose a kid as compared to an adult. How do we balance this so that we may ensure that we also incorporate them as we wake up with the COVID-19 easing up?
Okay, very, very, very pertinent issue. Our children,
yes,
and especially the young, and even the adolescents. Bringing up a child is not an easy task. As a parent, you bear me witness.
Yes.
And then having this child go through difficult circumstances makes the situation even worse. So with regard to our children, our Kenyan children in our homes, how has the situation impacted them? I have kids in my home. I know how the situation was, how difficult it was to explain to them, tomorrow you are not going to school because, well, the country has been locked down, now you will be staying at home. And then they are seeing mom and dad are not going to work, so we are spending the whole day in the house with them, you know,
a new normal for them.
A new normal for them. There were very many questions. The interesting thing is that children sometimes go through situations differently from us adults. They are able to adjust, you know, get into a new system of doing things, get new games, you know, make friends in the village, mix with each other. And actually there has been anecdotes going on that the COVID pandemic to some extent has been good for our families, for us parents to bond with our kids.
Yes.
Because we got to spend more time with them at home. We got more time to do homework with them. We got more time to go to the shamba with them, show them how to hold a djembe and a panga, how to look after chicken and cows and goats. You see, that was good. In fact, I feel it was very good. But then we know they have to grow, they have to go to school, which we know was affected because there is social distancing and our classrooms are overcrowded, and you know, we have to find a way of decongesting.
And the kids are so touchy.
And the kids are so touchy, and their numbers are many, which is good. But now, how do we experience and how does the government address these issues? First, we have to agree that we have come from a setback. You know, COVID itself has been a setback to us, socially, economically, financially. And now we have to make a comeback, you know, from this. We have to find a good way to segue from the setback to the comeback. And that is exactly where we are. We are not yet out of the woods as a country, as parents, as a government. And it is at this situation which is this situation is a make or do or not do, you know. Find ways of getting the kids back to class. They are adjusting to the CBC curriculum, you know, and all. So the children are actually going also through a difficult circumstances. And it needs prudent decision making by everyone that is involved to protect our children and make them grow well by providing for them, of course. And it boils down to what policies have been put in place in terms of healthcare provision for the children. If you have been keen, you will notice that vaccination has not been very heavily directed to the children.
Yes.
Science is still evolving. We are getting more data. We are getting more information. We are getting more guidance from the scientific community. Do we vaccinate or we don't vaccinate our children? So the healthcare domain needs to give us direction about this. How do we handle our children and the COVID pandemic? And then, of course, there is the effect of the disease itself on children. We don't have sufficient data as yet to know what has been the effect on them in terms of the COVID pandemic. And then now, in terms of mental health, our mental health situation, it's a function of our nature, you know, and our nurture, the environment in which we are. How has this particularly impacted our children? So we will need data, like my friend is suggesting, to know what has been the effect in the community of this pandemic on our children, on the adolescents. You know, have the levels of stress went high? You know, have the levels of depression went high? Have the levels of anxiety increased for our children? You know, For the adolescents, is there an increase in abuse of substances, you know, because of exposure, because of peer pressure and all that, you know? For the young people, is the idleness impacting them in a bad way? So it's an entire conundrum.
In short, a parent has to be very, very vigilant to observe what the kid is going through each and every day, perhaps to identify if there's something wrong.
Exactly. So the aftermath of the entire of this situation, in terms of our health status, in terms of our mental health, it is an evolving situation, and we need the data. You know, we cannot dwell on hearsay. We need actual data, like my friend Newton has been insisting, to know what is the situation.
Indeed, and Newton, still on the same, on what Doc is saying, is that you do support a lot of people, and majorly you have an orphanage, home.
Yeah.
Were you able to pick out some of the issues that, of course, were happening in the orphanage that normally wasn't going on, and identified that also these kids have been, in one way or the other, affected by the pandemic?
Yes, because, for example, being I have an orphanage home, I'm running a home, there's a lot of challenges, even for the children who are living at the orphanage. Number one, they see things are not normal in their lifetime. Like if I talk about a little bit of education, you know, we lost one year.
Yes. And
the Ministry of Education is trying to cover up that 1 year in 1 year. So you will realize that now we don't have holidays that the children used to have, because we used to have 4 weeks, 3 weeks,
and now we are
5
piling
weeks.
more pressure.
Now we are piling more pressure on them to cover the syllabus within the term. So one term actually have 2 terms.
Yes.
This is another challenge to our children, because they were not used to it. You know, the brain of a child needs a break of playing, a break of doing other things, and now then they come back again to learn. Number 2, this CBC, it's good because I'm running a school and I understand how it is difficult. The CBC came, it's a good idea for, to the Ministry of Education that they brought, but it was like she was born before time. She was born before time.
Mature a bit.
It is not mature as we speak. The government could actually wait. They first practice it, bring it slowly, understand how our teachers are going to use the curriculum and mix it and make our children learn. For example, most of private schools has no books for the CBC, the textbook. They only give the textbooks to the public school. This brings something in my mind, that under the Ministry of Education, we have private Kenyans and Kenyans. You see? Number 1, I have my own school with where my orphans are going to. These orphans, they are there because they lose their parents. That, number 1, affected their mind psychologically. Because they are there and they see some people with their all parents, and then they don't have their parents. That is number 1. Number 2, now they cannot get the books for the CBC. That is number 2. I have to make sure that I source it, because the books are not published in any bookshop that you can go and buy. And the ones that are in the government are written not for sale. That's a challenge to these children, because they don't know now where they belong to. If they belong to Ugandan country, or they belong to Kenyan country, or they belong to who. Number 3, they have challenges like adolescent stage. Everybody passed there, and our children must pass there. If there is nobody, because this now I'm talking about the ones whom I'm covering at the orphanage, there are a number who are not covering in any orphanage home. They are living with the grandchildren, with the relatives, who somehow are not taking 100% care of knowing that we have change of human life. This is the number which are having been affected with early pregnancy, infected with HIV/AIDS, infected with other diseases related to sex, and nobody is there to talk about it. So it is a big challenge to the children who are orphaned as we speak, And it's a big challenge to those who are running homes, because even we need to receive some funding or some food from the government to support these orphans. But let me tell you, there's nothing coming from them. So which means if I fail, then this child is again having another problem. The another problem that I always see, even though we are giving 90% of what we can, they still think about their family. They still think about their parents. So you can give up to 90, but it reaches a situation where now they are satisfied with what you give to them. But there's a question, why did my parents die when I'm still young? That's another sensitive question that comes to their mind. I have a number that because we have a break. When we have a break, I used to take all the children back to their guardians. Because, you know, again, there's another big challenge of land issue. If you take a child for 8 years, when they will go back, they will find now they don't belong to the family, they don't have anything. So in every break, I have to take them back to their guardians. Number one, to cover. Number two, to see their grandparents. But some has no place to go. So I always take some to me. They belong to me now. So the bigger challenge again that we see, we should work on this. I don't know how it will work, that the Ministry of Education can actually organize a social talk to all the institutions, public and private institutions, and even to the orphanages.
Perhaps they can increase the number of counselors?
Yes, that's what I'm coming to. We need to actually add the number of counselors. We need to know where the offices are. We need to have their numbers, in a way that now whenever we have a need, we just reach them and they come and they give counseling to our children. Those are the facts that we need and we are missing in agenda that we have as a country. If we can have all this, you know, the problem, my brother, is that Kenya is a fast growing country. We know that. But number two, the people in the country grown so fast than the economical growth. So we are almost 60 and the economic growth is almost 20. So the gap is so big. When the gap is so big, now you and me have to feel it. Because this world of computer, we have reached the world. You can Google and see the world. But you personally, you have not reached there. That is what is killing this country. Apart from the economy, that is really bad. The economy is bad because we think big than what we have. Can I take you a little bit to our neighboring country, Tanzania?
Yes.
1 minute.
A minute, yes.
1 minute. If you see the economy now is growing stronger than the economy of Kenya. Number one, because the late president there said, before we go and look any other support from any other places, let us start to utilize our resources. Number one, for us to help these poor families or to reach out these the people who has need, we must ensure that this country has light industry, that we can manufacture our own products. Then from there, the country will grow and catch up with the economical status. You see, when we get there, now there will be possibility of going back to the community and support a vulnerable family or in taking one of their family members to give something to do and bring. By the time we're doing something as a country, 70% of people are working, even if there's small money coming in. Then now the tax will come in. When the tax come in, the tax now will pave the roads, the tax now will buy the medicine, the tax now will give us the clean water, and then now we are going to grow, and all this problem actually will not be there. And the tax now will actually build other health facilities near to the people.
Yeah. Okay, and Doc, perhaps to strengthen what Newton is talking about, when you talk about education, of course, our kids are vulnerable because they actually depend on us on almost everything. Looking at the COVID-19 pandemic, and then looking at, of course, the new way of doing things. Of course, we have been rushing, or as Newton says, all the curriculum, a week holiday, and we still they have to go back to school. Their brains are growing. They, of course, affected by the COVID pandemic. Is it an added pressure to our children, especially mentally?
Definitely.
To digest all that in the midst of a pandemic?
What happens with children,
yes,
if you observe from a very young age, is that they are in a period of rapid growth. Growth physically, growth mentally, growth intellectually. And the environment needs to be set up in such a way that the needs of these children are actually met when they should be. So when a child is 1 year old, needs the presence of the parents, for the emotional attachment, for the emotional growth, for the intellectual and mental development of that child. Research has shown that close proximity between the mother and the child, the father and the child, is very important, which is where my friend Newton comes in. He's handling orphaned and vulnerable children.
Yes.
So from the outset, the circumstances have already hit them hard.
Yes.
What about every other child? And then now we have the COVID-19 pandemic, and children, and the circumstance of our specific education system in Kenya, which is actually going through a change both for the children and for the parents. If you follow the discussion quite closely, you will agree that there have been questions about how ready are we as Kenyans and how ready are the teachers to actually take this system and take our children through it. As parents, everyone wants the best for their child.
Yes.
So it is very important that these issues are addressed. I believe there are good points, and maybe there are also weaknesses with the KBC system,
yes,
which is what is being implemented now. It's already in a number of years in operation, and I doubt whether there is much that can still be done to reverse what has already happened. So how do we address the situation as it is now? One, the government, the Ministry of Education needs to actually make a concerted effort to get buy-in from the parents, make us understand what are the children going through and how are we prepared to actually take our kids through this.
Yes.
Because it is an issue that affects each and every parent, each and every single day. When I see my son coming home with homework, when I see reports from the teachers, when I see a new system, which is actually foreign to me, because that is not what I went through.
Yes.
I went through the 844 system with all its strong points and the weak points. It made me who I am. It made you who you are.
Yes.
That is what you are psychologically aware about. Yes. But you're not psychologically aware about KBC. So as a parent, he needs to be prepared. I need to be prepared. You need to be prepared. Every Kenyan parent needs to be prepared about it and enlightened about how to handle it. And now with regards to the intellectual, moral development of our children, it is very important that these things are inculcated in the system. And then the resources availed. He mentioned a point that it's as if we have a private and a public system in our environment. Thinking about it, well, I feel it's the nature of our capitalistic society. Quite unfortunately, our foundation as a nation probably was not as socialist as what the late Julius Kabarage Nyerere was able to establish in Tanzania.
Yes.
From whom we can borrow a riff about how they do their things,
yes, and
improve our systems. Thinking through it, it's about politics. Yes, politics is very important. We cannot escape from politics. I feel that everyone plays politics in their own way. When you wake up in the morning and you make a decision to brush your teeth, to get out of bed,
yes,
to what kind of shoes you wear, what color of clothes, what suit do you wear, you're actually playing politics with yourself on a micro scale.
Yes.
Then this politics then is scaled up to the decisions as a country we make. Where do we put roads? Where do we build a school? Where do we build a hospital? There are decisions, political decisions that have to be made. And how do we make good political decisions? It's by having good leadership and good politics. We get good leaders into those positions. Well, we will say as Kenyans we are recycling the same leaders and everything about that. But then how do we go about solving that conundrum, that difficult circumstance? Maybe we need to enlighten our citizens. our people about how to make good choices and ensure that there is equity, and an opportunity for us as Kenyans to determine ourselves, to make the correct or the right choices of who we want to lead us. Because you bear me witness, as a medical practitioner and as a psychiatrist, I can mention counties. Go to Makueni County with Professor Kifudha Kibwana. That is a model county where the mental health care services are actually working for the citizens.
Actually, the mental health, the health situation there is quite enviable.
Quite enviable. What magic is Kifudha Kibwana doing in County Makueni that, another governor in another county is not doing? What are the ethos? What is the approach to leadership that Governor Kifudha Kibwana is implementing there so that their system is able to run and work for the common mwananchi? Maybe he's not a self-seeking politician. He went there to serve the people. So how can we change our politics in our country so that they work for our people? So it's a very important discussion. It needs an enlightenment of the people as Kenyans so that we get good readers. But then back to the question about our children, we need systems that are working for the public, for the private, for the vulnerable. We have systems for the protection of children with special needs. We have approved schools. We have a ministry and a department that is responsible for handling children with special needs and all that. And also we have some system for social protection of children. We have some constitutional processes that are followed in case, a child has been neglected by the father, the mother, there is the office of the children and all that. These things need to be strengthened because we might have very good systems on the paper, but then the implementation is not very good.
Indeed. And just in case you joined us, this is KBC News Check, and today we are looking at the socio-economic impact of COVID-19. Of course, it affected all sectors of the economy, and some people are even disturbed mentally, but they don't even know. But because of the pandemic, now that we are starting to rebuild after cases, of course, in the whole world, there's vaccination, cases coming down, and of course, economy starting to open up. It's exactly a week since President Kenyatta, of course, announced some austerity measures, including injecting some money into the economy. But at the end of the day, we still have the COVID-19 pandemic, and it has affected all of us. And of course, I am with Dr. Leonard Njiru, who is a psychiatrist at the Kenyatta National Hospital and also Mathare National and Referral Hospital. And we have a philanthropist who is Newton Ogad. Of course, we are also live on social media, so for comment, suggestion, or even where you're watching us from, we highly welcome that. Perhaps, guys, we can look at the social protection which has been exposed now that we've realized we have COVID-19. That's where we are seeing a lot of loopholes, some of the things that we were not able to do or we should have done. Newton, can you kindly touch on that? Because we have a lot of vulnerable communities. We have the elderly, we have people with disabilities, we also have informal workers, and we our social protection as a country and also as a region is quite wanting.
The challenges that are still there, we cannot run away and we cannot hide, is that we have been told on social protection or coverage how we can actually be social protected, but we are not given the materials. For example, a 70 years old woman who is a widow with orphans at home, you are telling such kind of a person to protect herself due to COVID pandemic measures, which is actually true and right. But this lady is suffering of eating something in the evening. This lady is suffering on how the grandchild, who is actually an orphan, will go and get education. It was a good move of telling and for us to be self-reliant on protecting ourselves concerning the COVID. But the measures were, the structure was not actually put in a correct way. Because as a country, as developed country, I was in the US 2 months ago. They said social protection because of the COVID. But they provide masks for free. Nobody's buying any mask anywhere. They provide this chanjo in almost every state. They provided a lot, and they were paying their workers without going to work. they are paying those who are not working because they have to eat. So even if there was lockdown, there was a sense in it, you see. But here we have been told to provide to ourselves while we don't have nothing to eat at night. And you will find our police officers arresting the same 70, 60 years people who are going to the market to get their food, to feed their orphans back at home, and put in the police cells, and they need 1,000 shillings or 2,000 shillings. You see, so according to me, I'm talking on behalf of the widows in this country. I'm talking on behalf of the vulnerable in this country. It was not sensible to me to put the message without doing it. As a Ministry of Health and a country which is being governed by the President and the Deputy President and the ministers and all the government arms, we should actually come with an outline of providing essential services to all people there at home. I was watching at my TV last night or the previous nights. I see over 1 million people in the roadside without mask, celebrating those who are looking for the election move, shouting and campaigning on their election position that they want to win. The same people are going back and they cannot afford to go to Nairobi Hospital or Kenyatta.
Yes.
These people are going back with COVID, and most of them are dying. By the time they are in the public rally of politicians, there's no police officer who is arresting any because they are not having taken care of measures which have been put by the Ministry of Health. But after the meeting, when our big fish ran away with their helicopters, when you're walking now into your house with 100 shillings that you have been given there, then you are being arrested and put to the police cell to pay 2,000. The measures were good.
You've contravened the
but I'm against it another way, that we should provide what we need to provide. My friend, we are in the same country. Last 2-3 months, we had a case in court where our government, our people, stolen the money for the COVID-19. I've never seen anybody in court. I only saw some people in the parliament trying to sanitize themselves that they're clean. By the time that money got lost, how many people have died? You are going to the press and telling us you be self-reliant on this. So I like how they said it, as my brother said. We in this country, we do a lot in paperwork, but we do little into the people.
Indeed. And of course, we will be delving much into that, and Doc will be helping us know how we can ease mental pressure now that at least we can say that things are starting to look up. We talk about medication. There's people talking about ventilating by exercises and everything. But at the end of the day, we need to look at this issue in a more positive way, because things are starting to ease up. Let's first of all take a quick break. We'll be right back.